Hello, my name is Jane Cummings and I'm the new Chief Nursing Officer for England. I'm really happy to be able to talk to you about the new information strategy, the power of information. Here at the Commissioning Board, we have three key things that we think are really important. The first is that we are clinically led. The second is that we are centred around our patients. And the third is that we are focused on improving outcomes. Information is absolutely crucial to all of those three things. As clinical leaders, you will all be involved in providing care, supporting care, or helping patients to navigate their way through the system. Using information to ensure that you are giving the best evidence-based care, that you are measuring the impact of that care, and that you're able to improve the care that you give is crucial. From a patient point of view, the ability to choose where they go for treatment is becoming ever increasing, or is increasing even further. Having information available that tells patients how they can choose where they want to go, what's important for them, what's good in terms of individual services or hospitals or areas that they want to go to is vital. And in the past, we haven't been very good at giving patients the information that they need. There's been an assumption by many that patients should get what we think they need rather than what they think they need. And this information strategy very, very clearly puts power in the hands of the patients and actually encourages them to search out the information they need. I fully support that and think we should be treating our patients as equal partners. Patients need to be able to have the relevant information to make decisions about their own care, to determine what treatment options they have, and to use information to support them in that. And finally, we're very focused on improving outcomes. And in order to do that, we really need to use information well. We need to understand the impact of the care that we're giving. We need to be very transparent about that, to be able to tell each other as clinicians and healthcare professionals, and also to our patients and to people that actually commission care on their behalf. What are the outcomes of the care that's being provided? How can we improve? What else do we need to do? As the Chief Nursing Officer, I have 5 key words that are really important to me. Those are care, compassion, commitment, communication, and courage. And if we spend time reflecting on what that means to us as nursing professionals, the use of information to support that is critical. In terms of care, it's about what we do. It's what we do day in, day out. It's about caring for our patients in a way that truly delivers improved outcomes. Having information to support that is really key. We have an ability and a need to treat patients with compassion. So if you're talking to patients about what's important to them, understanding the impact of the compassion that they may have received on their patient experience is critical. So the use of information in terms of asking patients for feedback helps us as individual nurses to think about the care that we give and the way in which we give it, and to truly deliver compassionate care. As healthcare professionals, I think we've all got a commitment to improve. We can only improve when we know what we're doing and what the impact of that is. So again, having information readily available to us is absolutely critical. Communication is vital, whether that be between ourselves as healthcare professionals, whether it's to our patients or their other carers, or whether it's to our leaders and the people that we work for. Having the relevant amount of information to pass between us is really important. How many times do you go and see patients and ask them the same questions that somebody asked them time and time before? As a patient, how frustrating is it when you answer questions once to somebody and then within half an hour you get asked the same level of question again? We need to use both technology and the information strategy to really make sure that we only do things once, that we do it right at the right time, and we're able to spread that information and share it amongst all the healthcare professionals looking after our patients. And finally, the last C is around courage. That's about courage to do the right thing, to speak up when we're not happy about something, to actually be able to have the courage to make the commitment and make the changes that we need in today's reforms. And I think as healthcare professionals and as nurses and midwives and health visitors, we've got the ability to actually use the information strategy to help us deliver against the 3 key areas I referred to at the beginning, but also those 5 key words. We use information ourselves on a day-to-day basis. We use it to book our holidays, to order food online. How many of you have got mobile phones that have got technology attached to them to allow you to check the weather, to look at your travel arrangements, to book your next Tesco delivery? Why is it that the health service can't do something in the same way? We really need to step up, use the information strategy to allow us to really drive forward and use information and technology to our own advantage and to the advantage of our patients. Thank you very much.